Monday marks 1 year since the U.S. reported its first coronavirus death. Since then, the virus has killed more than 514,000 Americans, and more than 28.6 million cases have been confirmed. Meanwhile, the U.S. now has a third vaccine to fight the virus. Johnson & Johnson was granted emergency use authorization for its single-dose vaccine. The company is now shipping out nearly 4 million doses nationwide. As of Monday morning, more than 50 million people have received at least one dose of a coronavirus vaccine. More than 25 million are now fully vaccinated. But top health experts are urging caution as new variants spread across the country. And the head of the CDC warns that easing public health measures could risk the U.S. losing, quote, the hard-earned ground we have gained. Errol Barnett begins our coverage from Louisville, Kentucky.
A shot of hope as the rollout begins. Johnson & Johnson's vaccine now set to be shipped across the country. Proven in tests to be 85% effective against severe illness, it's the first single-dose vaccine.
We're on track to deliver 4 million within the next couple of days, 20 million by the month of March, and we'll have 100 million doses between now and the end of June.
This comes as more than 50 million Americans have already received at least one vaccine dose from Moderna and Pfizer. And as the number of new COVID cases nosedives 73% in the past 2 months. But COVID cases and deaths have plateaued at levels much higher than before the last devastating surge.
Please hear me clearly. At this level of cases with variants spreading, we stand to completely lose the hard-earned ground we have gained.
Tonight, Houston becoming the first U.S. city to see cases of all the reported variants, including those first found in California, New York, the U.K., Brazil, and South Africa. Also tonight, another concern. COVID testing is down 23% since Inauguration Day. Some testing sites empty.
It was like a ghost town. There's nothing there.
Or turned into mega vaccination sites.
If we did see another surge, we're never going to be able to track it, and we are not out of the woods yet.
Schools starting to reopen in Chicago, Las Vegas, and in Marin County, north of San Francisco, some high schoolers are back.
We're going to have like a small class, but I think it'll be, better than just staying at home.
As for the vaccines themselves, they can't come soon enough, especially in New York City, which identified its first COVID case 1 year ago today. Since then, nearly 30,000 have died from the virus.
We don't have enough vaccine. Every day someone's not vaccinated, they're in danger. When they are vaccinated.
Also tonight, the CDC confirming the effectiveness of 2 doses of the Pfizer and Moderna vaccine in protecting against the coronavirus when compared to 1, pushing back at recent studies highlighting the success of a single dose. Elaine?
Errol Barnett, thank you. Dr. Paul Jarris joins me now. He's a chief medical advisor for the not-for-profit MITRE Corporation and the former health commissioner of Vermont. Welcome, doctor. Thanks very much for being with us. Nearly 4 million doses of Johnson & Johnson's single-dose vaccine have shipped out Monday. In what ways could this vaccine be a game changer?
Well, this is really an encouraging development to have another vaccine available to us, particularly a vaccine which does not need to be kept frozen and is a single vaccine. So that will really help us reach much more of the population more quickly. And particularly some of the vulnerable individuals. They may be the homeless, they may be rural or frontier individuals, or people that show up in a mobile clinic that you don't know will come back for a second shot. So it really will speed the process along.
Well, on Monday, the White House said that setting up vaccination appointments, quote, remains too difficult in too many places. Why is that, doctor? And what needs to happen to improve the process?
Yeah, I think the fundamental underlying issue is that we don't have enough vaccine. So even with a perfect appointment system, people would not be satisfied. But it's a lesson to be learned here, and unfortunately learned again, as we did in H1N1 in prior episodes. And that is we invest so many resources in the vaccine development, and we seem to forget that vaccines don't give themselves. We need to also, early in a pandemic, invest in educating the public, gaining acceptance, but very importantly, our public health system so that they can administer the vaccines as they're produced.
Yeah, it's a really important point because you're right. We're a lot of times just focused on the vaccine, but then this idea of distribution and sort of devoting some resources on the front end, even as the vaccines are being developed, it seems would make logical sense so that the two could come together when a vaccine is in fact approved. Is a very astute observation. Doctor, some people who have received the Pfizer and Moderna vaccines are reporting coronavirus symptoms after getting their first shot. Help us understand what's going on here.
Now, it's very important to remember that the first vaccine is just that, the first vaccine. The immunity isn't as good as after 2 vaccines. So even after the first vaccine, we cannot let our guard down. We have to wear our masks, we have to social distance, and if we get ill, we should get tested. And we're finding more and more now from the jurisdictions out there using our tool, Sarah Alert, to monitor people in isolation and quarantine in case contacts, that people are getting their first dose, then getting sick, and then have to go into quarantine or isolation until they recover. So important point is we can't let our guard down. You're not immune until 2 weeks after that second dose. And even then, it makes some sense to wear your masks.
Right, really important point. Well, top health officials are concerned that variants could reverse the current downward trend in infections. More than 2,400 cases involving variants have been confirmed in the U.S. so far. So how big is this threat, and can we avoid another surge?
Well, it's very important, again, that we don't let our guard down. There are 5 variants now that we're watching closely. And that means people need to be tested when they have symptoms and are sick. And unfortunately, we're seeing that testing drop because unless we test and find someone who's infected, we can't then test to see if they have a variant. And very importantly, we can't let our guard down on quarantining people who have been exposed and isolating people who are sick. So the tool we've developed, Sarah Alert, will be important now, and jurisdictions are using it to actively contact and help people every day in quarantine so they get the care they need when they need it, as soon as symptoms develop, but in isolation to be in touch with them every day so they're not released into the community until they're no longer infected. Even as the rates of this come down in the community, it's going to be very important to identify people, to quarantine them, to isolate them, so we can put those brush fires out before they flare into another forest fire.
Yeah, this program, Sarah Alert, it's a contact tracing tool used in 16 states, which you help run this program. I wonder, though, beyond that, how are contact tracing efforts across the United States, you think, Doctor, going right now?
Well, again, we unfortunately didn't have quite the resources we needed in this system set up, which is why we, as a nonprofit, stepped in to say, let's build a system to really be a force multiplier for public health so that an epidemiologist or public health nurse can monitor many more people by automating the process. But it is going to continue to be incredibly important, again, to do this so that we can control these variants. If we can find the cluster and surround it, isolate people, treat them before it spreads further, very incredibly important. I'd say, Elaine, though, it's a similar lesson to the lesson we learned about not standing up the capacity to provide vaccines. What we tend to do is to look at pandemics or outbreaks as if they may happen, may not happen, when in fact we know they're a fact of life and they will happen. It's almost as if we shutter the fire station and send the firemen home between fires. We would never do that in a community, nor should we drop our focus and limit our responsibilities among public health professionals in between these pandemics.
It's a really excellent point, Doctor. And I think, for most average Americans, the situation we're currently living in is just unimaginable. But as you point out, there were public health officials all along who very well understood that this is something that not only could happen, but that would, in fact, happen. All right, Dr. Paul Jarris, thank you very much, Doctor, for your insight.
Thank you, Elaine.